everything normally. Brittany will answer if anything's abnormal. Okay? So, that's the scenario. Go. All right, I have my BSI. I'm thinking about my personal partner, patient safety. My environment looks safe. The street's blocked off. PD's on scene. I have one patient. It's him. Mechanism of injury. It's auto versus pedestrian. Additional resources. I want ALS tummy. Need for spinal mobilization, extrication. Managing partner. When we get to him, do you hold C-spine? I see an adult male, conscious and breathing, and no immediate life threats. Hi, sir. My name's Anthony with the ambulance. So move your head, okay? Partner, could you take over? Just in case you have an injury in your neck. What's your name?
Noah.
Noah, what happened?
I got ran over by my car.
Oh, okay. That's embarrassing.
Yeah.
What year is it?
2017.
And can you tell me what city you're in?
LA.
Okay. Take a deep breath in for me. In and out. In and out. Okay. Instructor, I know that he's alert because he was tracking me as I approach him. I know his airway is patent because he's talking to me without difficulty. No need for suction, no need for adjuncts. His breathing rate, rhythm, tidal volume, effort is normal rate. Rhythm is regular, tidal volume is adequate, effort is non-labored. I checked his lung sounds, and she'll jump in if there's any abnormal in the lung sounds. At this point, I give him no oxygen. And radial pulse, the rate is regular, rhythm is regular, quality is strong. Color, temperature, moisture, skin is pink, warm, and dry. And no life-threatening bleeding. And if you're a pediatric, I'd also do CAD refill. No physical deformities that I see, no neurological disabilities because he's ANO times 4. And I'll do pupils because optional pupils because it's a possible head injury. Exposed, I would cut out at least his off his outer clothes and then cover him with a blanket to keep him warm. And chief complaint, I just want to reemphasize, what's hurting you the worst?
What's hurting me the worst? On my back.
Your back? Okay, so chief complaint is the back. Notice I made sure I knew what the chief complaint was. And what's closer to ALS to the hospital?
Hospital.
Okay, so I'm going to do a rapid transport, but first I'm going to do a head to toe. Let me know if anything hurts, okay? Doing a rapid physical exam looking for life threats. All right, head right here. Open your mouth. Okay. Deep breath in. Okay. Okay, any pain in your stomach?
No.
Okay. Long socks.
Sorry.
All right, no one wear hoodies tomorrow for the sea collar. And have zipper boots. All right, wiggle your toes. Okay. Which foot am I touching?
Left.
Which foot am I touching?
Right.
And good pedal pulses. I did it, but I'm also saying it just to re-emphasize so the instructor sees that I did it. Okay, wiggle your fingers. Okay, which hand am I touching?
Left.
Now?
Right.
Okay. Gonna do detailed on the neck here. I'm looking for decapitalis, palpating the back, C1 through C7.
Step off.
Looking for step-offs. There is a step-off. Oh, well, I'm sorry, sir. Please don't move. If you have any accessory muscle use, any JVD, I see deep JVD actually, any subcutaneous emphysema, palpating, tracheal deviation, palpating, stoma, medical alert tag, sweeping, putting on the collar. What's that? Pacemaker. Okay. Whew, buddy. All right. Get my imaginary partners and get him to roll. Roll towards me.
Yeah.
1, 2, 3. You can kind of just talk to the C-spine part of it. So he's holding the head, palpating the back of the head. I can't see the neck anymore. I'm palpating the spine all the way down. I'm looking for a decapitalis. Looking for sacral edema, sucking back wounds, subcutaneous emphysema, incontinence, and sweeping the back of the legs all the way down for decapitalis. My partner can help me. Roll him back. Put him totally in the straps, do the head tape, do CMS again. Now he's fully in the backboard. Now we're going to transport right now. Now I'm in the ambulance. I'm going to get a full set of vital signs. Then I'm going to do up here C. Then I'm going to do sample. And now I'm going to do a detailed head to toe. Okay? So I'm going to be looking for decapitalis. Looking for deformities, contusions, abrasions, puncture, penetration, tendons, lacerations, scars, swelling, crepitus. I'm checking the forehead for symmetry. The forehead, parietal, temporal, occipital. Sweeping my hands for blood. Looking behind the ears for any battle signs, soot or soot or cinched nose hairs, CSF blood from the ears and nose. Open your mouth. Any oral trauma. Looking for raccoon eyes. If I did any pupils before, I could do it here. Nose intact, face intact. I can't do the collar because it's already covered. Going down to the chest, I'm looking for paradoxical motion, subcutaneous emphysema, accessory muscle use, lung sounds if I wanted to do them again, and sucking chest wounds. Thank you. So happening when I can. I see that pacemaker, pressing down again on the shoulders. Take a deep breath in. Good. Another one. Okay. Good sternal stability. Okay. Going down to the stomach. I'm palpating and I'm looking for any rigidity, guarding, distension, ecchymosis, signs of pregnancy, evisceration, pulsating masses. All right. Just palpate here. Okay. Pressing down and in on the pelvis. I'm looking for any incontinence, priapism, discharge, bleeding, or anything like that. Going down the legs, taking my time a little bit more. And of course, if this was something like a gunshot wound victim, I might be doing more of a sweeping motion, looking for blood. Kneecaps intact. Down to the feet. Wiggle your toes for me. Which toe am I touching?
Left big toe.
What about now?
Right pinky.
Okay. Good pulses, and so CMS is intact. Go up here, bend this. Okay, you bend that?
Yeah.
All right. Okay, bend here, lift up. Okay, wiggle your fingers for me again. Okay. And which finger am I touching?
Left pinky.
And now.
Right pinky.
Okay, good. And I'm sorry, did you wiggle? I forgot already. There you go. So now I'm just going to keep reassessing every 5 minutes because he's a critical patient. I'm going to reassess his ABCs. I'm going to reassess his initial injury. So his pain level, I can redo some of both here, see just to see how it's doing, and I'm going to reassess his vital signs. The only thing I'd add, if he had signs of shock during ABCs, then I would also add oxygen. And that's about it. All right, cool. Out of curiosity, how much